Delhi?
I'm in Hyderabad.
Okay.
Doing pretty well. So we are live on Facebook. And
Okay.
hi everyone, my name is Dr. Sneha Roo. I'm the founder of Ori Kalankini. I'm also a palliative physician. Ori Kalankini is an organization that's changing narratives around menstruation and sexuality in India using art, theatre, and dialogue. This series is called Leaning into the Network series, where we're bringing people from different parts of our network to meet each other. They're sharing their journey, they're sharing their skill, and they're sharing the most important work that they're doing at this moment. So today we have with us Dr. Abhirami Prakash. Dr. Abhirami is a doctor of naturopathic and yogic sciences. She is also the founder of Pirai, an organization that's making beautiful, high quality cloth pads, which we were just speaking about. So, thank you, Abhirami, for spending 1 hour with us and giving us your time.
Thank you. Thank you,
So, what I
Sneha.
thank you. So, I hand over the mic to you, Abhirami. Please go ahead and take us through today's topic, PCOS, which is stressful for most of us.
Okay. So I think your voice was breaking. I don't know whether it's because of my network or your network, but
Oh, I don't know. So basically, I was introducing you as a physician of naturopathic and yogic sciences and as a founder of Pirai cloth pads, the quality of which is very, very high, and I have, got good feedback around it. So yeah, so over to you. Share your screen. Take us through today's topic.
so today we'll see about polycystic ovarian disease. So, and also a management guide, because we just don't want to address a disease, we want to address the management also. So that's why we are here for this 1 hour. So what is PCOS? We hear this often, like we get to see a lot of young women, especially school and college goers are the one who are having this problem, and they doesn't know it when they are having. They know that they are having PCOS only when they come for an infertility treatment once after marriage. So when they come, they complain that they have this complaint since their school or college and they didn't have their regular menses. But most of the time, what women do is they don't take care of it immediately. So it is just like, okay, I missed my periods for 2 months, it's okay. Once in a month, once in 3 months, I get my menses, I just get spotting. So they are okay with all these things. So this has to be addressed immediately. That is the intention of this session. So we want to put some light on the things that women should know, and when is the right time to check with a gynec, or what are the dietary and lifestyle modification needed. Okay. So first thing, what is the thing called polycystic? What is a cyst? Is a fluid-filled follicle. Okay, you can imagine a small balloon filled with water. That is the exact thing called cyst. So in polycystic ovarian disease, we have a pair of ovaries on either side of uterus connected by a fallopian tube. So these ovaries are surrounded or filled with this cyst that is called poly. Poly is many and cystic is a fluid-filled balloon-like structure that is in ovary, that is polycystic ovarian. And when it happens, it's like a bunch of grapes that is putting pressure on the ovary, so it doesn't allow it to release the eggs. There are so many reasons that happens, but this follicles doesn't mature, allow the follicles to mature into egg. Before that, it makes into empty follicle cyst that causes the egg to disintegrate. Okay, so this is what is the main problem. When you don't get your egg out of your ovary, you are not fertile, right? So you are not able to, you cannot get conceived. So that is a complication that we see it many times when people come to us for infertility. So it's very, very prevalent. That is the main thing. It affects 1 in 10 women. Can you imagine? If you see 10 women, one woman has PCOS. Mostly they are unaware of it. Only when there is a problem, they check with the doctor. And another thing, it's a main leading cause for infertility. And another thing is, it's just not with the infertility. We think the problem of PCOS only with the uterus, right? No, that is not a thing. It sets in a set of metabolic disorder. It disturbs the fat metabolism. It interrupts with the insulin resistance and insulin secretion. So it is a problem that controls the entire body. It may put you into a sick picture very soon if you are not taking care. Okay. So this is what exactly happens. The normal ovary, the egg, the follicles develop, mature, and the egg is released. And after that, the follicle becomes a scar tissue called corpus luteum, and it becomes a corpus albicans later on. So this is a normal ovary. So, but what happens in polycystic is the follicles doesn't get matured. So when they don't get mature, they become immature follicles becomes a fluid filled cyst that is in polycystic ovary. So this is the picture we get it. So you can see this a bit more clearly in it. The follicle is developing. In a normal ovary, it goes into ovulation. Egg is released into fallopian tube. And if there is fertilization or if there is a sperm, so embryo is going to be formed and it is going to shift to uterus and going to develop into a baby. So if that doesn't happen, the multiple immature follicles, it becomes a cyst. So that's it. We see in PCOS. So we this is all microscopic things. Nobody can see our ovary, like other than the scan, you can't see anywhere else. Mm. So you have to we come to know that we have symptoms by these symptoms. So there will be heavy bleeding, menstrual irregularity. It could be heavy bleeding, it could be spotting, absence of menstruation, short and light bleeding. Most of the time, we think polycystic ovarian happens only when there is absence of menstruation. It is not necessary. Sometimes even spotting could be a symptom. Sometimes after 4 months, they get a heavy bleeding for 10 or 15 days. That could be also a symptom. So whatever the menstrual irregularity, it should be ruled out by proper investigation. It could be blood investigation. It could be hormonal assay. You have to check your progesterone, estrogen, testosterone levels, androgen. All these studies should be done, and scan should be done. All these things should be done if ever you have a menstrual irregularity for more than 3 or 4 months. Other symptom we see very commonly is overweight and obesity. So overweight we see in lot of adolescent girls and boys now. But the main problem is our lifestyle. Thanks to Swiggy, Zomato, and lots of transferred junk foods that we have at easy availability. So that leads to a lot of weight gain. So this weight gain and PCOS is a very closely linked thing. So if you have overweight or obesity, always you have a chance of developing PCOS. And if you have PCOS and there is a chance to develop, you may start gaining weight. It both are a vicious circle. So you have to stop and cut it somewhere to efficiently manage both overweight and PCOS. Okay. And skin and hair. This is one thing that we get patients to hospital. Like girls start developing beard, facial hair. The male pattern of facial hair. They get hair everywhere. Scalp hair starts thinning, and the skin gets oily, and it becomes very rough. You can literally feel it. The skin becomes rough. So all these are problem of PCOS and hormonal imbalance. And these things can cause anxiety and depression. Anxiety, especially in married women who are into the getting pregnant. So they have, when they have PCOS, they have this anxiety. So they always are very anxious. Is this month I'm going to get pregnant or not? So all these things causes anxiety, and when they don't, they get depressed. So, and this can happen because of PCOS. And PCOS in itself, with the because of hormonal imbalance, it can cause mood swings. Very bad phase a woman faces is a mood swing, and because of PCOS, it is aggravated. Okay. And finally, infertility is also another factor. So these are the symptoms. So we spoke about a lot of things that happens when one have PCOS. So why exactly it happens? Why it should cause? What is the reason? As of now, there is no one single cause that you can put it, name it. Like this is a diabetes caused by high sugar content. No, PCOS doesn't have any one single cause. Nobody can put a finger on it and say that this is the cause of PCOS. That is nothing called like that. But there are lots of theories that it could be this and it could be that. And we are trying to figure out the full medical fraternity. Still, it's trying to figure out what could be the one single cause of PCOS. Okay. So till then, we have all these theories. And the main two theories that we think it could be true and we suggest the treatment based on it is genetic reason. There are women and families in which PCOS runs from mother to daughter, grandchild. So it just goes in families. Like you can just ask the family history of a patient, and they may be telling that my aunt, my mom, and everybody had this irregularity. So you can come to a conclusion that genetically their ovary they have high level of androgen. So that could be one reason. Second reason that we see very often is environment. Environment in the sense it has diet, sedentary lifestyle, it could be stress, pollution, etc. And even high level of insulin in blood. All these things can contribute to PCOS. The second reason, environment works very well, because when we correct the diet and lifestyle, we see a good number of PCOS patients getting back to normal regular cycles, and also they are very much fertile. A lot of PCOS patients was able to get baby by monitoring all these changes. So we can think that environment has a very big role in causing PCOS. It is both good and bad thing. Good thing is it is all changeable. PCOS is completely reversible. Even if you have a genetic predisposition to develop PCOS with a correct lifestyle, diet, and stress management, one can easily come out of PCOS. Okay, so it is not a disease that you are labeled with, like you have to be with PCOS. No, if you are really interested, you can do changes in your lifestyle and you can totally come out of it. So this is a thing that happens. We were discussing about the causes. So when you have a genetic predisposition, so what happens is the ovary androgen secretion is more. When there is more androgen secretion, you know that androgen is a male hormone. It is not a female hormone. We do have androgen, but the quantity is very less in normal people. In PCOS, the androgen quantity is very more. So when it is over secretion, there is excess secretion. What happens is it leads to increased testosterone levels. Again, testosterone is a male hormone, which is a predominant male hormone. We do have, but it's in a very less way. When there is increased testosterone levels, what happens is the LH levels are increased. So what happens is, so a normal menstruation, for the egg to release and for the uterus to build the tissues and all those things, we need two hormones: follicle stimulating hormone and luteinizing hormone. This follicle stimulating hormone is the one that helps the follicles in the ovary to develop and release the egg. And the luteinizing hormone is the one that that helps in the building of endometrium and in prolonging if the baby is to the pregnancy, if the women gets pregnant. Okay, so that LH level, if it is increased, it is going to stop the ovulation. It's a normal phenomenon. If LH is going to increase, the ovulation is going to stop, because in a month, if a girl gets pregnant, she doesn't want another egg to release, right? So that's the reason LH levels are increased after ovulation. So in not PCOS, what happens is, because of the increased testosterone level, the LH levels are increased. When the LH levels are increased, there is anovulation. Anovulation is, there is no release of egg from our ovary. So this is the thing. And one more thing, what happens, this increased testosterone level is, there is insulin resistance and hyperinsulinemia. So this is what we are going to discuss in detail today. Insulin resistance is one of the main factor for type 2 diabetes, and hyperinsulinemia is another thing that happens when there is insulin resistance. That is going to be increased insulin in your blood because cells can't take it. So this too, what happens is, it disturbs the liver function. When the liver function is affected, it affects the fat metabolism. That's the reason lot of PCOS women has a risk of cardiac disease. This is very, very important, because when the insulin levels are increased, the liver becomes haphazard. So the liver is the one that has to work with the fat metabolism. So what the liver does, it increases the bad cholesterol, decreases the good cholesterol, and it causes dyslipidemia. So actually, we don't die with hypercholesterolemia. We don't die with high cholesterol. We die with imbalance in the good and bad cholesterol. That is dyslipidemia. So that happens, and that is very, very bad for our heart. So you can understand that PCOS can cause diabetes, can cause high cholesterol, and it can also cause cardiac diseases. Along with all these things, when this testosterone is increased, that is the one contributes to the male pattern of hair pattern. So a lot of women have had the face. So all these things are caused by these things. So now you can think of a management by yourself. We are going to check the insulin level. We are going to increase the insulin sensitivity of cells. We have to check the cholesterol, and then PCOS is easy to manage. Okay. So as we discussed, you can understand that the PCOS is not just a uterine disease or gynecological problem. It can cause diabetes, it can cause high blood pressure, it contributes to imbalance in the fat metabolism, that is unhealthy cholesterol is increased, LDL and VLDL increased, HDL is reduced, and because of overweight and other factors, it can cause sleep apnea, like the breathlessness you get during sleep, depression and anxiety because of the hormonal imbalance, and sometimes it can cause endometrial cancer also. Okay, so these are all the complications of PCOS. So management. So how do we manage? So there is a solution for every problem, both in medical and non-medical. So first we'll go with the medicine. Modern medicine, they suggest anti-androgen medicine. So by genetic or environment, your ovaries secreting excess androgen, right? So what they give is, they give anti-androgen medicine. Second line of treatment is metformin to maintain the glucose level, to hyperinsulinemia, insulin resistance, to work on all these things, they give metformin. Metformin is the one most commonly I have seen with a lot of patients with PCOS. Girls as young as 16 years, 17 years, they start taking metformin, and it's very, very bad to take for quite a long time. From 17 years, it's going to be a very long time. So these can temporarily help you, and it can restore your menstruation also, normal menstruation. But to have a long solution for this, you have to come to the basics. That is maintaining a proper glucose level and fat level. That way, the hormones are balanced. Okay? So the dietary modification to reduce weight if you're overweight. And another misconception is, lot of people think only fat people will have PCOS. No, there are thin people who have PCOS also. So in that case, you have to check your sugar level and you have to make sure that your insulin resistance, they can be insulin resistant also. So you have to check with that and you have to clear that also. Because many people think that only when they're fat, they have PCOS. This is not true. There are lean women who has PCOS also. And another thing, apart from diet, we have exercise, yoga, and importantly, stress management. All these things also will help in management. You may think, why stress? Because when your body is under stress, it could be as small as you're stuck in a traffic kind of stress, or you're late for an appointment kind of stress. But body thinks it same as a threat of survival. There are only two options: either you fight or you flight or you run away. So there are only two options. Body only thinks in that sense. So the body creates a lot of chemicals, cortisol, adrenaline. So all these things makes your body, it gives a panic attack. So it gives a panic attack, like you have to run or fight and all those things. So when all these things happen, your hormone levels varies very vastly. It disturbs the sugar metabolism. It gives a false alarm in fat metabolism. So entire body goes haphazard. So each time you are in a stressful condition, it triggers a set of reaction in your body that is very much similar to your do or die position. Like it similarly works like that. Like there is a threat of a cheetah or an elephant chasing you in primordial days. The body responds same way to your boss or your traffic signal. So you have to be very careful with that. We may be thinking that it's just a small stress. No, there is no small stress and big stress. Everything is body is same. So this is very, very important. So in dietary modification, so what are we supposed to eat? So I get a lot of patients who says, I don't eat anything else other than my home food, which is especially in South India, we have rice as a staple food. So rice in the sense people think only lunch. No, we have breakfast, which has idli, dosha, puttu, idiyappam, appam, everything. Everything is rice in form of fermented or non-fermented, freshly grained. We have rice. And lunch is again rice. And the dinner is going to be rice or chapati. Again, it's going to be a carbohydrate thing. For many years, we have been thinking now, for some 50 years, we have been thinking that fat or bad, right? So every time we meet a doctor, we are advised to cut down on fat to reduce weight. They don't tell about carbs. But what is the problem is carbohydrates are the culprits, not fat. Because in fat, there are two fat, good fat and bad fat. Yes, it's true that bad fat is very bad for health and it has to be stopped. But to fight with bad fat, our body needs good fat. So the good fat is what we have in nuts and good oils like coconut oil, olive oil, and which is very much good for our health. So you have to differentiate that there are good fat and there are bad fat. So, and again, next thing is if we are skipping carbohydrates, what to eat. For example, anybody in India will have breakfast other than this breakfast, I said idli or chapati. We don't have any other option. And also pulses, all the tur dal and every kind of dal variety. This is our staple food. South India or North India, this is a thing we keep changing and eating. If not this, what we are supposed to eat. So you have to choose a diet which has low carbohydrate, high fat, and moderate protein diet. So a country like India is a vegetarian nation. We are the country, we have lots and lots of vegetarians. So actually we are supposed to be the healthiest. If vegetarian is the healthiest food choice, our country should have been the healthiest country in the world, but that is not so. So we are the country, we have we are the diabetic capital of the world. India is the diabetic capital of the world, and we are fast raising in cardiac diseases also to get the first place. Why is it happening? Because French and European countries, they have high fat and they have animal protein, but their cardiac indexes and cardiac health is much better than us Indians. So you have to think on what is the problem and what kind of food is exactly right. So that's why you can adapt a diet which is low in carbohydrates, which is high in good fat and moderate protein diet. So here I have shared a sample diet chart. This is not for everybody, because you have to take the gynecology or a dietitian appointment. You have to personalize your diet chart and everything. But this is an example for a low carb, high fat, and moderate protein diet. So morning you can have almonds, which is soaked and washed and roasted, a few almonds, tea or coffee without sugar. I don't recommend tea or coffee, but there are people who can't live without it. So for them, you can have it, but without sugar. You can add butter instead. And you can have eggs for breakfast, but not bread. So we are so much used to bread and butter. We are such a bread and egg, cheese sandwich. So we add a good food with the bad food. We add idli, and we add other, what is it, coconut chutney is good because coconut is very good. It has very good fat. But we mix coconut chutney with idli. So it's like we mix. So eggs are good, but egg sandwich is bad. Biryani, chicken is good, but rice is bad. So these are the small changes that we have to understand when we go for this diet. Okay. So breakfast could compromise all this, is comprise of all these things. And lunch, you can go for a very small bowl of rice with unlimited amount of vegetables. You can have vegetable, chicken, fish, paneer, any milk, dairy products, anything is fine, unless and until it is not preserved, added with some preservatives or something. You can have anything. And 1 cup of fresh curd is very essential, because curd is a probiotic. Probiotics are very essential for our body because it helps in maintaining normal gut bacteria. We all are we are talking about virus, corona that's happening now. But our body has so many bacteria. We live with bacteria, lots of bacteria. So these bacteria are the good, there are good and bad bacteria, but good bacteria is needed for normal functioning of our digestion. So for that, a curd is very good source of good bacteria that has to be taken. And evening, you can snack on few peanuts and undried guava. Fruits, again, if you are into really strict diet, you can cut down all kind of fruits. That includes mango, because mango, jackfruit, pineapple all have very high sugar content, fructose. Again, it's a fruit sugar, but still it has high content of fructose, which is also a form of carbohydrates like glucose. But if you are not into very strict diet, I can recommend you papaya and other fruits. You can have any banana. All these fruits you can have as an evening snack or something. And dinner try to have before 7 p.m. Why 7 p.m. is, for you to have a gap between dinner and breakfast, you should have at least 14 hours gap. So if you have breakfast by dinner by 7, the next day breakfast at 9, you have 14 hours of gap. So that gives your body enough time to process and assimilate the food that you have consumed. If you are having your dinner by late at 9 o'clock or 10 o'clock, immediately morning you get up with the early breakfast. So body doesn't have time for, you are giving both day duty and night duty for your stomach. So it is not going to work properly. So it causes indigestion and poor absorption and all this stuff. So the dinner as early as possible is good. Again, you can go for a complete fruit diet, papaya. You can have a fruit salad without sugar, obviously. and or without honey you can take assorted fruits and you can have, or one chapati. If you feel really hungry, then you can have one chapati with vegetables, chicken, whatever you had with the lunch, you can have the same thing. Okay. So what are the foods to be avoided? Mainly junk foods. So there are a lot of girls, especially PCOS is seen in adolescent girls. The first question they ask is, how do I live without it? So we go to with a friend to a restaurant, we go out, we have canteen in the college or school. So everywhere we see only junk food. That's a bad fate, but the thing is that's the truth. We have chips in preservative packets, we have added drinks, we have high sugar pastries, maida, everywhere we have maida, everything is polished rice, everything. But once, if you really want it, this is if you take this as a part of treatment, just like taking medicine, you have to avoid all this food at least for 3 months. You can see your body transforming, like it's not just changing, your entire system transforms. You can feel the transformation. I have felt myself, and I've seen my a lot of my patients feeling the transformation. Like when you put junk food in your body and when you put healthy food, the body responds so beautifully to a different kind of food. So when you eat junk food, you have fluid retention. Even for normal people, the pain during menses, dysmenorrhea, or the pain in the chest, premenstrual mood swings, everything happens. Everything seems to be very much high in the people who are taking lots of junk food. If you are taking regular, organic, and very good diet, all these symptoms seems to be very less. This you can try yourself for a month to check how these foods affect you. So, and again, after junk food, we have refined grains, any grain, maida, even polished rice. It's white in color, right? You know that this one doesn't come in white color. It's been polished many times. So the rice, the bran has vitamin B12. So the rice that we eat doesn't have any vitamin or mineral. It just has carbs. It just gives you glucose and energy. So all the good nutrient things it's being taken from rice. So that is the reason we have to avoid this polished rice. As much as possible, you can go for organic brown rice. That's good. And trans fat. The trans fat, all vegetables, sunflower oil, everything. Vanaspati, mayonnaise. Many people used to ask me, the sunflower oil is good. But the problem is, vegetable oils are good, but the thing is, they are being processed. Have anyone tried sunflower oil without refining? We don't get it. So what happens is when you heat a vegetable oil, like for coconut oil, if you get it, you can just boil it and see. After some time, it gets vaporized. But a sunflower oil or anything that is refined doesn't get vaporized. You can keep on the stove for so much time, it doesn't get vaporized at all. The reason is a hydrogen atom is being added to these oils to withstand high temperature. That is the reason when you see in a fast food store or a restaurant that you see in the roadside or restaurant, they keep boiling the oil from evening till late night. So the oil doesn't do anything. It doesn't change its nature. That's the reason we tell people to avoid food from outside. The same chicken that you fry at your home, you will be using the oil only once or twice. But a person using it in a restaurant going to keep using the same oil for different batches of chicken. So that changes the nature of oil. That leads to a lot of trouble. So oil, fat, everything's good, but the way we process, the way we consume is the reason it becomes bad. Okay. And concentrated juices and added drinks has high content of sugar. You can check a Rasna packet or Maza, anything. Behind the bottle, you can see the calorie and sugar content. You will be shocked. One spoon of all these things have so much of the sugar content there, especially if you give to kids, Rasna or Maza, all these things regularly, you are going to develop dental caries for them. So these things can cause a lot of problems. So when it goes inside also, it causes so much problem in different multiple systems, not only in digestive, with the liver and pancreas, everywhere it's going to be a problem. And alcohol. Again, if you want to follow any diet, first thing you have to cut is alcohol. When I suggest diet to my male patient, first thing they tell me is, Doctor, almonds are good. Can I take with alcohol? So that's what they ask me. If you want to follow any kind of diet, alcohol should be stopped. The reason is, in a day, if you are having all the good food, like you are taking care of your vitamins, minerals, good food, low carb, everything. If you have one glass of alcohol, it's going to rob all the vitamins and minerals that you took the day, and it's going to be wasted. Okay. So once in a while partying, that's all fine. But if you are making it to a regular habit or recurrent, or you are addicted to it, then it has to be stopped. So no diet works with alcohol. So that thing you have to be very much clear. So okay, that foods to avoid. What are the foods to have? So you can use the fat, good fat, that is coconut oil. You can use butter, ghee, olive oil. Only these things can be used. Other than that, you are not supposed to use any kind of vegetable oils or other oils that are refined and processed. Okay? You can have any kind of dairy, curd, whole fat milk, paneer, and butter. Many times we see people asking for skimmed milk, right? So recently, skimmed milk has become a fashion thing. Like people say, no, I don't drink full fat milk, whole fat milk. I use skimmed milk. But the problem is, the whole fat milk, the fat in milk is so good in good fat. It's essential for the body. The problem is when you take skimmed milk, it's already been processed and all the fat has been taken. So it doesn't have much fat, and it should be discouraged. Skimmed milk is not so good for health. You have to always go for whole fat milk. So you can have paneer, butter, all the dairy food, and animal foods, poultry, red meat, fish oil. There are even little tablets, fish oil. It's very good to get the omega-3 fatty acid. So you would have been hearing, because omega-3 fatty acid is becoming very famous now, thanks to the commercials of vegetable oils. They are putting omega-3 and all these things. But the thing is, all the vegetable oil have only omega-6. But what the body needs is omega-3. It needs omega-6. But the problem is we have so much omega-6 from trans fat. We have less omega-3 from good fat, like in nuts, fish, or shellfish. All these have good omega-3. So the balance between omega-3 and omega-6 is very important. Without that, our cells are going for inflammation. So this inflammation in pancreas, it causes diabetes. In liver, it causes problem with fat metabolism. In ovary, it causes polycystic. Anywhere inflammation. Inflammation is nothing like you get a scratch in your skin. We have scar for a few days and then it just goes away. So each time you eat a junk food, there is going to be a scar inside your blood vessels, inside your vital organs. So what happens in a day? It doesn't happen anything. A few days, the inflammation becomes very worse. So that's the reason if you start eating junk food, there are people who say that keep eating junk, but I'm healthy. That cannot last for long. So your body starts getting all this inflammation and it keeps deteriorating. At some point of time, it can't handle more and it leads to organ damage. Only when there is organ damage, we come to know that, okay, my body is very much affected. For example, you get a heart attack. So only then you come to understand that, okay, there have been bad fat, so much bad fat in my body. So that has led to this heart attack. You have stroke, you have high BP, you have PCOS. So you come to know that, okay, there is a problem. Only when there is enough damage is done, body responds outside. So it's better to take it in the first step itself, like to manage all these things with good diet. And leafy vegetables is very important, because a good fiber diet is very essential in PCOS, and fruits. Fruits are very, very good. And exercise. Why exercise is needed? So you have to know about insulin sensitivity for that. For example, like you have water everywhere and not a single drop to drink, just like in the ocean. What do? You can see water, but you can't drink it. Same thing in insulin resistant. What happens? You have so much insulin. Your body has insulin. Your body keeps um, producing insulin, but your cells can't recognize it. Your cells has become mute to insulin. So what happens? Body has insulin. That is called hyperinsulinemia. So much insulin in blood, but cells can't use it. So what is the use of insulin? So cells become deprived of insulin. It can't metabolize glucose. So type 2 diabetes. All these are caused by insulin resistance. So exercise is an excellent source to increase the insulin sensitivity. Another thing is in PCOS, reducing weight is very, very important. Reduces body mass. Exercise reduces body mass. For example, your body is so big. Your body's insulin production capacity can cater only for 65 to 70 kg of body weight. For example, you are 85 and you are 90. So what happens? Your body cannot produce so much. So it gets exhausted. There is no insulin. So this is a problem we face with obesity and type 2 diabetes, mellitus, and obesity and PCOS. When your body surface becomes big, your body can't cater to everybody. So like you just can imagine like a restaurant in which there are only 4 tables and there are 4 people who serve them. For example, there are more people, each table have 10 guests, and the people who serve cannot serve everybody. So the same thing happens. Your body goes on expanding, your insulin cannot cater everybody. So that's how body mass is very, very important. You have to reduce your body mass to your height, and weight should be equal. Means in the sense your weight should be ideal for your height. So in that case, your body's insulin sensitivity will be very, very good, and you can lot of problem can be reduced only with this. So exercise plays very, very vital role in reduces body mass. Not no, body mass in the sense lot of women and men have their tummy put on. Like just their tummy becomes grows so much. We call it as beer belly or whatever. But after pregnancy, the tummy weight is very, very bad. Your accumulation of weight in the central part of your body, that is in abdomen, causes a lot of problem. So even if you are not concerned about your entire body, you have to be concerned, but still you have to maintain your tummy. Your tummy should not become so big. That is a very, very important thing in PCOS and type 2 diabetes also. And exercise helps you in fighting anxiety and depression. For example, you put a good music in the morning and you work out for half an hour, your whole day, your mood will be very, very good. In spite of lockdown or whatever the depression you have, just try this for half an hour every day. Your mind is going to be very, very active, and your body will be trying to tell you, like, thank you, because I have felt it. Like when you really fighting anxiety and depression, exercise is an excellent tool. It helps you physically, mentally, and emotionally to get out of your inhibitions, and you can really feel it. That is a very good thing. And exercise improves HDL level. HDL is a good cholesterol. LDL, VLDL, or bad cholesterol. The good thing is HDL increases when you take good fat like nuts, butter, and good oils like coconut oil and ghee. But it also increases when you are happy. When you're stress free, your HDL levels are increased. When you do exercise, good aerobic exercise increases HDL level to a very great extent. So all these things are helps you in fighting PCOS very, very efficiently. And again, aerobic exercise prevents the cardiovascular diseases. It could be heart attack, a stroke, or anything. Each time you do workout, you are keeping a heart attack one day away. So this is a very simple thing. So these all are not medicine which is easy to take, but it is painful to begin. But once you start this, you will be very much thankful for your. It means it's very much easy to manage it by yourself rather than taking medication continuously. So, and again, exercise is a general term. You can choose aerobics, Zumba, it could be anything. But yoga is another totally thing which is not a merely an exercise. It also works at multi-level. It works on your conscious level. It works on your emotional, intelligent, physical, and mental level. So it is like it helps you in stress management better than the exercise. So what happens is it sublimes the emotion. As I told you, whenever you have a hormonal imbalance, you get to have a lot of mood swings, right? The emotion gets chaotic. We respond very, we react, we don't respond, we react very rashly, and all those things we put our emotions very blandly. So all these things can be controlled by yoga. Subliming the emotion. You can't always express your emotion, and you can't always suppress your emotion. When you suppress your emotion, it comes out in very ugly ways. And when you keep expressing your emotion, you tend to cause many problems to the people around. So you should know to sublime the emotion in that way that it doesn't hurt you or the people around you. So yoga helps in subliming the emotion, and there are specific asanas which helps in increasing the insulin sensitivity. That is very very essential. And there are breathing and meditation that helps in adopting mindful living. So here, mindful living, I am telling because of we need to go for mindful eating, because stopping something you are eating for all these years needs a lot of mental preparation. So you have to be very much conscious of what you eat. You have to choose the correct food. So all these need mindful change in you. You have to be conscious of why you change. You should not give in to your cravings. So all these things needs a mindful thing, and yoga helps in stopping the cravings and will help you to get into a very healthy lifestyle in eating and everything, and promotes good sleep. Sleep is very very essential. So many people think sleep is very easy to get. No, once you cross your 40 years, you can find that insomnia is the biggest problem we face. So getting a good sleep will correct lots of hormonal imbalances. When you don't get a proper sleep, your stress level shoots up, and there are lots of hormones which doesn't work properly when your sleep is disturbed. So all these things directly contribute to PCOS. And since PCOS is a lifestyle disease, only correcting your lifestyle can help you in this. Medicines can help you temporarily, but to get a complete thing out of this, you have to follow all the lifestyle changes. So this is one asana. There are a lot of things, lot of poses, meditation, pranayama, and so many things. This is one thing, a simple butterfly stretch, which will help in PCOS or any menstrual irregularity. So in this, what happens is it opens the ligaments in the hip joint and the pelvic region, so that increases the blood circulation, and it overall it strengthens the pelvic muscles and uterus, and it's very very good for any menstrual irregularity, and for PCOS it's very very good. So the final key points that I would like you to take from here is, one thing, you have to check your mindful eating and relaxed and stress-free life, and moderate to high intensity workouts at whatever you feel good at, like if it is exercise, dance, Zumba, yoga, whatever, but you have to do something with the workout. So that's all. Thank you. So you can ask any doubt if you have.
Thank you so much, Dr. Abhirami, for taking such an informative session. Like, in what I really like about your sessions is that you start from the basic and slowly take us through the whole process, which I really enjoy. Thank you.
Thank you.
Yeah, and till medical science doesn't have a pill for stress, I think we have to keep going and slowing down. I'll just
Yeah.
check if there are any questions on
Yeah.
Facebook Live. Mm.
Yeah.
So, hmm. So we have quite a number of people looking, uh, watching the um, watching the live. So we have two questions. One,
Okay.
Abhi, the person also is called Abhi, Admirable Abhi. They
Mm.
ask natural way to get periods, and then can we overcome from PCOD? I think both the questions you have answered in
Yeah,
your
very
previous.
answered.
Yeah.
Yeah.
And I think we can watch and watch this replay again. It's going to be on the Facebook page. Thank you so much again for 1 hour of your time and being generous always. So that's what I associate with you with. Thank you so much. Can you please share your email ID so that
Yeah.
if people have questions they can write?
Prakash Abhirami. Prakash, PRAKASHABIRAMI @gmail.com.
Thank you. Thank you so much.
So, okay, dear. So, bye.
Bye.